Instagram live, but I would be happy that if you ask me some questions in YouTube live, because understanding questions answers would be better rather than only studying Mater Medica. Before that, I'll just take one question which had come. So there was one question where the patient, one of the doctors told me that, sir, how to interpret the symptoms and how to convert that into a rubric form, and then how to prescribe in which potency. Now there is no fixed law how to interpret a symptom. It depends basically on your experience. If a patient is coming and tell you, there was a very interesting case which I'll discuss now. When you take a symptom and try to interpret in a rubric form, you have to know exactly the language of the patient and what is the patient wanting to tell you through that symptom or through that rubric. I had a very interesting case, and the patient, was suffering from arthritis. The whole case taking was done and everything was done, and then the patient came and told me, sir, देखते हैं, let's see. My joint is painful and stiff. I cannot walk, but let's see who wins. I'll walk and I'll make sure that my joint does not win. This is how the patient told me. Now, can anyone think about what was the patient trying to tell me? Patient of arthritis, the case taking was over and the patient had come to me, and the patient in a due course of time told me, sir, my joints are very stiff, but I'll walk. I'll see that I beat my joint and walk, though with pain, but I have to win this. I cannot just lie down. This was the symptom the patient was depicting of arthritis. Now, what will you interpret in that case? That is very, very important. If you understand, this is the whole crux of the case. Sometimes you take the whole case and one thing and you get the remedy. So welcome, Dr. Barbel. Hello, good afternoon, Dr. Sneha and Maurya, Dr. Maurya. So what do you think about this? How did the patient think about that, and what remedy would I have given? That is important. It is not always important what remedy I gave, but how did I interpret that symptom and we treated and cured his arthritis. Are you understanding what I want to tell you? Did you understand the symptom the patient told me? Anyone? Yes or no? Sir, I am suffering from arthritis. Good afternoon, Dr. Devangi. I am suffering from arthritis. My joints are stiff. I cannot walk, but I'll make sure that I walk. I have to beat my joint. I have to win this situation of arthritis. This was the wordings of the patient, my dear friends. So what symptom will you take for prescription? Or I can tell you what remedies come to your mind when this type of the patient talks to you. Can anyone guess the summary of the case? First of all, how will you differentiate this into a rubric form? People are joining late. Make sure that you join at when I start the case so that you don't have to repeat every time. Dr. Vishaka, good afternoon. Now, anyone, Dr. Babel, can you give it a try? What is the patient trying to tell you, and which rubric or which symptom will you take for prescription? Yes, anyone? Remedy you can get right, but how to enter the case, that is very, very. Now, what is the patient trying to tell you? An arthritis patient, crippled by the disease, but he wants to win by walking so that he beats his arthritis. This is the interpretation of the symptom what the patient is trying to tell us, and this is the symptom the patient is trying to tell us. Can you convert that into a rubric form, or can you convert that into a symptom form, or can you think about some remedies? I'll give you about 30 seconds or maybe 20 seconds so that our time is not wasted. Anyone? Anyone can think about any symptom, any rubric that comes to your mind, so that we try to analyze and try to understand the mentality of the patient and then convert into a rubric form. Yes, anyone? So the first symptom, I think there is no answers. not a 6 but the won't let himself to be beaten down. Yeah, okay, that is fine, but what does it mean? Means what? The rubric, it is very interesting, which I took for prescription. Winning and losing is basically when you are at war. So I took that rubric: delusion, war at being. Delusion, war at being. And the patient told me, sir, if I walk, it might break. I added this symptom also, and the only remedy that came to the repertory chart was Thuja. I prescribed Thuja. I started with LM potency 01, 02, 03. The patient is still with me. He is much, much better now. I can walk. He can climb my stairs also, and he is much, much better with Thuja 01, 02, and now 03. So this is how you have to interpret the patient's language into rubric form. The most important thing, my dear friend, that you have to understand is that you must know that these type of rubrics are present in the repertory. Are you with me? Dr. Babel, did you understand the rubric? This is very, very important. What will happen to my joint if it becomes deformed? I will look so ugly. Now this wordings, word to word, is present in Thuja. Delusion, ugly he is. You did not understand. An arthritis patient trying to tell us that I have to beat my pain, my arthritis, so that I can walk. I have to win this situation. I cannot let arthritis win over me. That was the wordings of the patient. Winning and losing. That means delusion, being at war. That is the rubric I took for prescription. And then I added few rubrics like delusion ugly and delusion body parts will break because they feel it is very delicate. And then I prescribed the patient Thuja. And Thuja cured the case. The patient is still with me. Maybe sometimes, Dr. Babel, if you come to Nagpur, we'll discuss the case. The patient will be there for a long time with me. So this is how you interpret a rubric. This is how you interpret a patient symptom into rubric form. Everybody, did you understand the rubric? First of all, let me tell you, have you ever taken that rubric for prescription, delusion being at war? It is not always war by swords and spades, Sometimes you are at war with yourself also in life. That is how you have to interpret that rubric. Are you with me, everyone? Did you understand what I want to tell you? Yes? Yes or no? If you don't get, first understand the symptom, and then you can go home and again, after the YouTube live, you can think over it. And I'm very much sure, yeah, delusion at war. Delusion at war. How to treat weakness in CKD. Yeah, the rubric was delusion at war. I think, Dr. Babel, you did not get because I was very fast. So, yeah, okay. So I'll try to be slow and so that you can understand. Delusion at being war, and I added few symptoms. Delusion that it would break because he felt like it is very brittle, and delusion ugly he is. And the remedy was Thuja. This is clear. I wanted to teach this rubric because that gave me a fantastic result. Whole case taking and the rubric form that cured the case. So this is how you interpret the patient's symptom into a rubric form. In short, I wanted to tell you. I hope this rubric is clear, everyone. Yes or no? Please try to take that rubric because that rubric contains very, very interesting remedies. Belladonna is there, ferrum metallicum is there, Thuja is there, I think platina is there, and hyoscyamus is also there. If I remember, few 4-5 remedies. They may be also there fixed also. Yeah, you can take that also. Fixate in Mater Medica, that you can take that also. But in arthritis, this fixity, lot of patients there. Lot of patients feel that the joints have become stiff. When I extend my leg, I cannot extend my leg. There's a lot of pain. This becomes sometimes common. But the patient telling you exactly the symptoms of war, it becomes then the prescribing symptoms. Okay. How to treat weakness in CKD patient? First of all, you must understand in CKD, the kidney is affected, and erythropoiesis, erythropoietin, which makes the blood hemoglobin from the bone marrow, is secreted in the kidney. So if you are suffering from CKD, automatically your HB becomes low. So if you try to give, tonics, or allopathic doctors give a erythropoietin injection, the name I'm not getting that name, Iption I think. Uh, uh, so you give the injection, the hemoglobin from 8 goes to 10, but after 15 days again goes down, because you are just giving from outside. It goes in the body, it shows in the report, and again comes back out of the system. Yeah, that's what I'm telling you. So basically, there are two things in this. If you give erythropoietin injection, the patient is much better, because you give blood and the patient is better. But what happens in CKD, because the molecule of erythropoietin is very big, so it cannot get filtered from the kidney nephrons, and this patient is already suffering from CKD, so it increases sometimes the creatine. Though patient feels temporarily better with the increased hemoglobin, but because blood is a protein, and because of that protein, the patient gets weakness because it cannot get filtered in the nephron, and the creatinine again starts going up. So if possible, in case of CKD, try to avoid this erythropoietin injection. You can give homeopathy medicines for that. Sometimes, hemoglobin 3x, people say, but I have not found results with that, but I have found good results with ferrum phos, lecithin in low potency. You can basically give a patient to take beetroot. We have remedies trituration prepared from beetroot also, 3x potency. You can give that potency. But your concern should be basically treating the creatine and treating the kidney. That is more important rather than just giving hemoglobin. Because if the kidney symptoms starts becoming better, the kidney starts coming out from that failure, automatically the hemoglobin starts getting better. In fact, I always see the reverse part. Sometimes, we give the remedy and the patient says, I'm absolutely feeling fine, healthy, I'm eating food, but the creatine from 4 has gone to 4.5. Then you check the hemoglobin of the patient, and the patient says, my hemoglobin was 8.5 and now it is 9.3. That means don't worry, the creatine will definitely come down, because the hemoglobin has risen, and it is risen because the kidney has started functioning, though very slightly. That's why the creatine has not come down. So if you find hemoglobin increasing, though the creatine has not decreased, still your remedy is right. You have to wait. Automatically the kidney will come out of failure. Are you with me? Did you understand this? Very important to know this in CKD patients. Did you understand, everyone? Dr. Vishaka, in personal, Dr. Babel, Divangi. Yeah, yes. So in CKD, I have wonderful results in CKD patients. The patients, Dr. Barbel, who came to Nagpur, are still with me. CKD patient, you must have seen Dr. Barbel. They are still with me. Creatine from 7 to 6 to 5 to 3 to 2, now 1.5, and they're absolutely better. I have only, I've never given them patient erythropoietin injection, though the HB was 7.5. I still took a chance. And you have to take a chance, because as such in orthodox school, there is no treatment as such. They are waiting for dialysis. And once the patient is on dialysis, the patient is waiting for the next dialysis, because they do dialysis twice or thrice a week. So you have to make the patient understand that this is the only hope, and you will wait for some time. If nothing happens, then we have hemoglobin injection, you give, and HB goes 8, 9, again comes back. So this you have to take into account, and you will definitely get good results. Okay. So I was just telling you something about Thuja. Some more points in Thuja which have crossed my mind. You must have seen lot of remedies which have anger, like Muxol, like Anacardium, like Naxomica, Chamomilla. But if you go and see Mater Medica very minutely, Thuja has got more anger from these remedies also. There's a beautiful symptom in Thuja. It goes, contradiction intolerant of, throws themselves angrily, throws themselves angrily on the floor and they cannot get their breath. And I've seen so many patients of Thuja so angry, cannot bear contradiction, throws themselves on the floor, cannot get breathe also. So much so anger is there. That is Thuja. No, it is written throws themselves on the ground when opposed. And Thuja is, what I have told is right, and right. You must have seen Ferrum metallicum, but there's a beautiful symptom in Thuja. Wrong cannot tell what is. Means if a Thuja patient, you explain the patient, sir, this is right, this is wrong. No. What I have done is right. He cannot tell what is wrong. You have to interpret that symptom in a different way. Thuja will come. There's very interesting symptom, aversion to mother. Aversion to mother. The only remedy is Thuja. Now see the height of anger. Normally we say mother is mother, you cannot replace her. So normally if you are angry also, sometimes it happens, you speak something, it is not intended, and then you patch up and everything is okay. But Thuja patient has aversion to mother. Tell me which remedy has it? The mother which is there, it is not basically that temporary phase, it is aversion, my dear friend. Thuja has it. Try to interpret it in a different way and you will find, my God, Thuja has so much anger. Thuja, it is written anger if things do not go what she or he has planned. That is also Thuja. See, I am telling Thuja because I prescribe Thuja. You can ask me questions, If you ask me questions, I'll be more happy. This is Thuja. And of course then Thuja, has aversion to mother, very abusive and insulting to husband. That is also Thuja. I remember a case where, the patient used to come and tell me, okay, sir, my son, does not get angry outside. But he comes home and he starts scolding my family, his father, his mother, sometimes to grandmother also. And whenever this symptom comes to you, which remedy we think about? Anyone who is always angry over outrages in families, father, mother, grandmother, brother, sister, anyone, but in the family, which is the remedy we think about? Anyone? Yes? Because this is the mistake which I have done in my practice because of some fixed symptom in Mater Medica. Whenever you get this symptom, you can think of two possibilities. There is a symptom in Kalikar, outrages in family members. Yeah. Iodum. Outrages in family, Kalikar. You can use other interpretation, contentious high school. Contentious basically hard on inferiors and soft on superiors. Then we have platina, then we have lachesis, then we have lycopodium also, these type of drugs, viratrum also. But this quarrelsome scolding to family, mother also, the only remedy is Thuja. So don't mistake Thuja and give Kalikarp. Don't mistake Thuja and give platina or viratrum, because they are more famous remedies, because it has been taught more aggressively in college and in webinars and seminars. That's why we miss Thuja. Thuja we only think for fixity, but that symptom you have to interpret becomes difficult. It is so much written in Thuja, quarrelsome, scolding to family, to his mother, to her husband. That is also Thuja. Are you with me? Are you understanding? Anyone? Yes or no? We are trying to understand Thuja, the anger of Thuja, which is much more than sometimes Moxol, Luxomica, Anacardium, Chamomilla, Belladonna. Very, very important Thuja. This I have seen in so many patients, aversion to husband, aversion to mother, scolding husband, abusive to husband, uh, quarrelsome with the family, to the mother, to husband, abusive to husband. If it is a minor form, it is normal in India, there is no problem. You can laugh it off. But it becomes a habit, then it is important. Are you with me? Anger tantrums, cannot bear opposition, becomes angry, becomes angry, like rolls in the floor because of anger, thuja. And every time we think about ignitia, it is there. But my dear friend, thuja is also there. Thuja is also there. That's what I want to tell you today. Sometimes when we go out, when we go have to, when we have to go maybe out of place, and a thuja patient has decided we leave at 6 o'clock, and for some matter you are not able to get ready. There's one question, so I'll first take the question. 37-year-old, right side upper eyebrow, recurrent headache, 10 times in a month, aggression from sleep. Okay, so very very classical symptoms. You have headache, right side, right eyebrow. Now whatever migraine cases I have, I'm not telling that I have cured everything, but lot of cases of migraine. In fact, I had a seminar in Germany 2 years back, and I taught migraine also. Migraine of 20 years duration, 30 years duration also, treated with homeopathy and cured also. Now, if you are basically prescribing only on the local symptom, right side migraine in the eyebrow, aggravation sleep or after sleep, then there are very few remedies. You have to understand migraine is a very painful condition, and you have to understand why the patient is suffering from migraine. Now in your case, if you see right sided above the eyebrows, you can think about natramure, lycopodium, elapse, carboanimalis. These are the remedies, like a tornado, and a lot of symptoms are there. Now you have seen aggravation after sleep. That means the first remedy you should think about is lachesis. First remedy, okay. Now if you are prescribing on this symptom, you might get results sometimes, but you can fail also sometimes. So this is the symptom which I have told you. But for me, if you ask me, please go and understand why the patient is suffering from migraine. If you prescribe on why, like for instance, I had a very interesting case where the patient told, where the father came and the son was about 18 years. Sir, treat his migraine because whenever he gets headache, listen to the wordings. Whenever he has headache, he becomes very abusive. हिंदी में क्या बोलते हैं, माँ बहन की गाली देता है. Whenever he has headache, he becomes abusive. Otherwise, he's a very fine child and normal child. And I went to the Mater Medica. I read that symptom. I gave the patient Corallium rubrum 200. Believe me, the child was suffering from migraine from 4 years. Corallium rubrum 200 single dose. No attacks till now. He's been following me for the past 6 months. Abusive in pain. Are you with me? Abusive in headache. The remedy is Corallium rubrum. Now, again, aggravation after sleep. Why this symptom is important more than the eyebrow symptom? Because normally after sleep, after rest, the headache is expected to be better. Now, the first remedy that everybody thinks about is lachesis. Think about also natramure. Think about Naxomica. Now, I'll come to the right side part also. Think about bryonia. Think about carbon sulf also. All these remedies are aggravation after sleep. Now, in your case, my dear friend, it is the right sided. So, carbon sulf, belladonna, bryonia, calibichrome, lycopodium, silicia. These are the remedies you can think about, whatever symptoms you have told to me. Is it okay? I had a very interesting case of migraine where the patient came and told me, sir, I have taken 1 lakh Ceridon, but still my headache is not better. If time permits, maybe in a webinar or a seminar, I'll show that case. Maybe I think this case I've showed in Germany. Dr. Babel would remember. I don't know whether I've shown that case in Germany or not. One lacks said on the patient's wordings. You must understand the intensity of pain. She used to take Celadon thrice, four times, 5 times in a day also, no results. Then just she had to take injections. So understand first why, and then you can enter the case, would give you better results rather than local symptom. But if you have local symptom, very nice, you can take that. So did you understand something about Thuja? I hope Dr. Anurag, the question is answered. Now, whenever you are sad, and what do? In a general talk, if you say when you are sad, you are dull, you are depressed, a male patient of 50 years of age, what will he do in sadness? Anyone? That is what Thuja does, and Thuja is better by that. What will you when you are sad, when you are dull? What does a person of 50 years of age? What will he do? Go home in the night, open a bottle of wine, just take one glass of wine, and he starts feeling better. That is Thuja. Sadness, amelioration from wine. I remember this symptom very, very precisely. I had a male patient, and he used to tell me this symptom, and the wife used to tell me, sir, just because he wants to drink wine, he's telling you this. Otherwise, how can you, if you want to, he's sad also, and how can he want to drink? And poor husband used to tell me, sir, and I feel, happy when I drink wine. So whenever I'm sad, I try to drink wine. First of all, I did not give him Thuja because I thought maybe it is okay and the husband is trying to fool the wife. But every time the husband used to come and say, sir, I feel very happy when I take wine. So I gave the patient Thuja, much better with that. So are you happy? I was telling you something about Thuja, I just forgot that. So if you have to go out of station, you have told everybody to be ready at 6 o'clock, but for some reason somebody is not ready. And the Thuja patient starts, Jaldi, do it fast, do it. He starts scolding the driver, he starts scolding the mother, the father, the children, somebody coming in his way, somebody. He's so, irritable. Hurry with irritability. That's a wonderful symptom of Thuja. So whenever you are, you find a patient where the time is set, and if it has overshot the time, and he is very hurried person, do fast. If the 6 o'clock time is decided, he will, at 5 or 5:30 wants everybody to be ready. Otherwise, hurry and irritability starts. Irritability. That is also Thuja, my dear friend. Are you with me? This symptom I remember because this is very, very common in India. You have to catch a train at 3 o'clock, and you must understand how the patient behaves, because these are all involuntary symptoms. The patient does not think and behave at that time. He behaves in that spur of moment, and that is the remedy of the patient. Are you with me? Yeah? Everyone, are you with me? Anurag, Abhishek, Zeenat, Devangi, Barbal, Mayur, Dr. Moria. Are you understanding how to understand Mater Medica? You can't remember all the symptoms, but the symptom which is very, pronounced and you have seen, these are very, very commonly understood. That's why you understand Thuja very quickly. I had a very interesting case of vertigo. And the patient came and told me, sir, whenever I'm talking, I feel happy. But why? When I talk, Thuja Netramur, I'll give you. But when I talk too much, I get vertigo. Now, how will you differentiate too much and less and okay types? This is Thuja. Talking long causes vertigo. Are you with me? Talking, sir, I talk too much, so that's why I got vertigo. We said, then don't talk. But this guy cannot stop talking also. Talking too much causes vertigo. Yeah, Dr. Maurya, it is already, we are closing the session. So maybe next time you make me again ask the same question so that I can differentiate. I'll not, if I talk very fast, sometimes a lot of people can't understand me. especially Dr. Babal also will have difficulty understanding. So I'll just have a finishing note on Thuja. So talking too long also will cause vertigo. That is also Thuja. If you remember my iodum, sitting still, amulet solve the complaints. That's iodum, which I taught you on Instagram. Please study the remedy. These are the remedies which I have understood in my clinical practice. Okay, so it's already half an hour up, and thank you so much. Thank you for joining, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Thursday on Instagram Live. Thank you.